Renelle. Yes, thank you very much. Good evening, everybody, and it really is a great honor to be here, especially as I've heard that this is the first of the live sessions or webinar type sessions that that you guys are going to be doing. I can emphatically tell you that my love for feathered animals has always surpassed most of the others, and my wife often, when she trains our horses, and I'm busy videoing the horses and I see something flying in the sky, be it an eagle or be it whatever, quickly the camera focuses on that and goes away from the horses. So it really has been a passion of mine. I flew pigeons with my father as a youngster, and even while I was at Onderstepoort. And as Renelle said, Mectin is very safe. So if you should drop a full drop on there, normally it shouldn't have any issues. But you're basically going to go a long way if you can use a 1 ml syringe with a 23 or 24 gauge needle on to actually drop a small amount. So you catch the bird, you part the feathers, and you actually drop it onto the back of the neck itself. Obviously, with the Gouldians, which are fast flying, and we often have 100, 200, 300 birds in a selection, and you don't want to catch them all, you don't want to use something like this. You want to just basically then use a spray. So the aviosecticide spray is a pyrethrin based spray, and you can then spray that onto the birds. This product is so safe that you can actually spray it onto 7-day-old babies in the nest. It has absolutely no side effects, and you need a massive amount before there's actually toxicity. So the insecticide does come in a concentrate as well. You can order it in a concentrate if you've got big aviaries, and you can mix it over the seed. As the birds husk the seeds, they will get enough of the avioworm in to actually treat the worms effectively. Very effective against roundworm, the large roundworm, and tapeworm. Sometimes we do get resistance from the capillaria, from the hairworm, and in that case we look at the aviosoluworm. Now I need to caution here that the soluworm contains levamisole and also praziquantel, and there has been here and there, specifically in some finch species, to a much smaller extent in the Gouldians, but in some finch species, if it's given in full dose for the full day, there have been cases of toxicity. So when you're using aviosoluworm, I suggest that you use it only for the morning, that you actually put drink the water out, and by 12 o'clock you remove the water. Don't leave it in for the full day. Again, it's been formulated exactly at the right dose. And I think in the cases where there has been toxicity, it's been where these cattle and sheep products have been used. So it is one to be careful of, but if you use it just for the morning, you should be absolutely fine. And the big advantage is the efficacy. It's really effective against the hairworm. Again, remember, as I said on the ivermectins, the ivermectins will not be absorbed by the pigeons and birds, and it will leach out. So if you can get hold of a moxidectin praziquantel from Better Farm, that's another option that you may want to consider. So that's on the treatment of the worms then, Renelle. We can go to the next one. Then we're going to look at the protozoan diseases, and the protozoa are basically the single cellular parasites that birds get. And of them, the most common 3 that I want to just very briefly touch on is trichomonas, known as trichomonas in pigeons and other birds, parrots, and cochlosoma in the finch species. Very much the same type of organism. It's basically a one-cellular organism that you can identify under the microscope very easily. So if a bird veterinarian or a laboratory technician takes a swab or a suction of the crop and puts it under the microscope, you can then see these little organisms moving under the microscope, and it's an easy and a very quick diagnosis to do. In the birds, in the finches and the Gouldians, the cochlosoma really is a problem, and we'll basically go on to that just now, just to explain a bit of what it actually does. Giardia is another parasite, and that lives primarily where the cochlosoma lives in the upper gastrointestinal tract, in other words, in the crop and the intestine, upper intestine. The Giardia tends to live more in the colon, the large bowel, and it can also be diagnosed in the same way by just doing a wet prep and putting it under the microscope. The veterinarian will be able to identify it. It's not as common in the finches and the Gouldians as it is in pigeons and some of the other species. And then the other one is coccidia, of course. The coccidia being the one cellular parasite that resides in the intestine. It actually lives within the cells of the intestine, and it actually also multiplies itself in the same way as worms do. It actually sheds these little things in the stool that we call the oocysts. And initially, these oocysts are not sporulated. In other words, they're not infective. So that oocyst has to lie in the loft, in the aviary, for a while. If it dries out, if it's a dry loft and an aviary, it will dry out and it'll burst and it won't become infective. If the aviary has got some damp or wetness, or there's areas around the water troughs, these will sporulate. When there's heat and humidity, they'll sporulate and become infective, and the birds will pick them up again, and they will just actually increase the load. So from a few coccidia initially, it will build up and build up and build up within the bird itself. And again, the diagnosis is made under the microscope with a flotation. Next one, Ronelle. Okay, so if we look specifically at the cochlosoma, because that's the one that I think is, I know is fairly common, specifically in Gouldians and in finches. And the symptoms, again, is unfortunately not always that clear. We do get standard unthriftiness. The birds just don't look well. They're anorexic. They don't eat as well. They sit with their feathers fluffed up, but they're not deadly ill. Slowly but surely, they start losing weight. We do get vomiting and froth from the beak and from the upper respiratory tract area. Diarrhea is often seen, and we'll show you a slide later on of the true diarrhea. And then, very importantly, one of the real giveaways would be the wet vent syndrome, be it in the babies or in the birds itself. If you catch a Gouldian and it's really thin and it's got this wet vent, and I'll show a photograph that was kindly sent to me from Ronelle, and that's a typical cochlosoma symptom. It doesn't exclude all of the others, things like salmonella and coccidia and things like that, but definitively it gives you a high index of suspicion that you're dealing with cochlosoma. And then again, very importantly, if you see undigested seeds in the droppings, that should alert you to cochlosoma as well. And then lastly, this one can go systemic. In other words, it can go from the intestine, where it normally causes most, and the crop, where it causes most of its problems. It can get into the bloodstream and cause abscesses in the liver and a septicemia. And of course, then the birds die as a result of the severe abscessation. Then good. Go to the next one, Ronelle. So what do we do treatment-wise for these? Luckily, the cochlosoma of finches and Gouldians are still very, very susceptible and very much able to be killed and treated very effectively with ronidazole type products. So our product in the AvioMed range is called Aviozole. We've got a 10% and a 25%. I think in the sense of the amount of water that you guys treat, you'll always be buying the 10%. The 25 is mostly for pigeon fanciers that has a great amount of 300 or 400 or 500 pigeons, or for the one race loft type people. Ronidazole, very, very effective, very safe. It's a single one-day treatment. If you find that it's not that effective, and you do smears and you see that there are still some of the cochlosomas alive, or the vet tells you that they're not completely dead, you can go to a second-day treatment. But unfortunately, as it is in pigeons as well, we are starting to see resistant strains of this cochlosoma. And in those cases, so if you've treated and you've treated with a 10% Aviozole or with another 10% containing product of ronidazole, one of two things has happened. Either the product is not what it should be. I can emphatically tell you that our ronidazole is sourced from the best company, the company that makes the best ronidazole in the world, from Spain. So quality-wise, we know you're getting the very best product you can get. So in that case, it would mean that there's resistance. And then you need to go to a product like avionidazole, which is a combination of ronidazole and secnidazole. So secnidazole being a newer molecule, and secnidazole also being longer acting. So you find that the ronidazole will actually do the initial killing, and then any of the organisms that are still alive after 24 hours, the secnidazole will still be in the intestine, in the bloodstream, and that will actually kill them. So the combination of ronidazole and secnidazole we'll then use in the resistant cases. Okay, next one, Renelle. Okay, so then the question is, can coccidia make my birds ill? Because we know that in pigeons and many of the larger bird species, it actually just causes a loss of performance, be it breeding performance or racing performance. But definitely in the finches and the Gouldians, a heavy infestation of coccidia when you're getting diarrhea like you see on the left-hand side, where there's a lot of fecal material, some water, and whether you don't have the nice round droppings with the urate crystals sitting on the top and with a little bit of feathers sticking to those to the droppings, you will then know that you can actually get birds getting thin, becoming unthrifty, becoming really ill, and actually dying. Very often what the coccidia will also do is that it will actually then predispose these birds to E. coli or salmonella, some of the other bacterial diseases. So it actually then by being there together with a bacteria causes the death of the bird. So yes, do we treat for coccidia, Renelle? That's the next question. Absolutely. There is no doubt in my mind that if you're a Gouldian breeder, you need to treat preventatively for coccidia as you need to treat preventatively for cochlosoma. So both of those diseases, I believe that you need to treat on a regular basis. And maybe in the next talk, Renelle, we can actually then look at the programs, which is on the AvioMed website as well. There is a canary program, and that's very close to what you would be doing with a Gouldian. We haven't got a very specific Gouldian one yet. But so just take home message, I would definitely treat for coccidia and cochlosoma on a preventative basis then. Which product is the best, Renelle? You can go to the next one. So here I would like you to also perhaps just pay a little bit of attention in the sense that we all tend to be so trade name specific, and I would like you to, when you start looking at treatment of your flock and your birds, to look at the active ingredient, not always just at the trade name, and to very carefully see what the active ingredient is. So here we're going to be looking at toltrazuril, and that's the active ingredient of baycox and coccyworm. Okay, so baycox being the one that is available for chickens, it's not made specifically for birds, and coccyworm, you can give us the next slide, thanks Renelle, being the two baycox that's made for chickens, and then the coccyworm. The toltrazuril has many advantages, and I'd like to just take you guys through the advantage. You can use the the sulfonamides, so things like aviocox, the sulfonamides and trimethoprims combined, or you can use some of the others like diclazuril, which is the older version of toltrazuril. But toltrazuril has major advantages, and if you can just give us the next slide, we can elucidate that. Okay, so why is toltrazuril the best? 4 different reasons. It's by far the safest of any of the treatments. If you treat with the sulfonamides and the birds are very ill, they can sometimes dehydrate and they can actually develop kidney problems from the sulfonamides. It makes little crystals in the kidney. So the toltrazuril has a very high LD50. It's almost impossible to poison any bird with a toltrazuril. It is by far the most effective product, so its efficacy is extremely high still. It's a newer product. It's not brand new, but it's a newer product. So in such a sense, there's not much resistance. It does not affect the racing or the breeding performance, so it has absolutely no effect on your breeding performance. And the most important one you'll see there in the yellow lettering, it actually prevents reinfestation of the oocysts. Remember, we showed you those little seeds that need to actually become from a sporulate and then infect the birds. So if they pick up new oocysts shortly after they've been treated, it actually prevents those oocysts from attaching to the intestine, and it protects for reinfestation for 2 weeks. So it's a case of in those 2 weeks, the rest of the oocyst has a chance to dry out, and the chance of reinfecting your birds is just so much less when you're treating with toltrazurol. So definitively the product of choice for Gouldians and for birds then. Okay, next one. Right, and then the question is there a product that will treat worms and coccidia effectively and safely? And I'm very proud to say yes, absolutely. Our cocci-worm will do that. Cocci-worm is basically a combination of AvioWorm and toltrazurol. So it contains pyrantel, praziquantel, and then toltrazurol. Okay, so it's a broad spectrum, very safe treatment for worms as well as for coccidia. It's in a tablet form. We will be bringing it out in a powder form where you can actually mix it with a soft food in the next few months, but currently it's only available in a tablet form. And that tablet treats, again, 400 grams of pigeon weight. So you'll basically be using 1 tablet per 30 birds, per 30 Gouldian birds. You crush 1 tablet per 30 birds in, so you look at how many birds in your aviary, and then take 1 tablet per 30 birds, very carefully crush that tablet, make sure that it's crushed nicely, and then mix it into the soft food, preferably so that they take all of that. You can mix the crushed powder with a little bit of water so that it mixes more effectively, but it's really a fantastic product to use in mass treating your birds for worms as well as coccidia then. Okay, Ronelle, next one. So then we're going to look at the questions that we received from you guys. I've basically covered as much as I could on external and internal parasites, and we'll go more specifically into what questions you've actually sent us. Okay, so let's have a look at the first one, Ronelle. One of the questions was, can you mix antibiotics with other antibiotics? You can go to the next one. And I need to just very briefly explain those 3 points. So yes, definitely some antibiotics may be mixed with other antibiotics, but there's no general rule for that. I can't tonight say in all confidence and honesty, yes, you can and may mix antibiotics. I truly believe that when you get to that point, it's something where you need to get your veterinarian's advice, and very specifically, you need to get a veterinarian that is dealing with avians and species and nose birds, and get advice on those. A very good point, case in point, is the product that Chris Kingsley loved so much. It's called Sinulox. That's amoxicillin and clavulanic acid. And that one works in the way of synergism. In other words, if you take amoxicillin and you add clavulanic acid, it strengthens the amoxicillin and it increases the spectrum. In other words, how wide that antibiotic can then kill the bacteria. So in many cases, we find, for instance, another very good example is the combination of doxycycline and spiromycin, such as in the AvioMed's Spirodox. Those 2 antibiotics work extremely well together. But another example, for instance, where you won't want to use it is you never combine a penicillin with a tetracycline. So you would never combine Sinulox, amoxicillin, and doxycycline or tetracycline. Okay, so, and then also we look very carefully at whether these antibiotics are bacteriostatic or whether they're bactericidal. And those fancy words, all that means is that many antibiotics work in a way where they actually slow down the growth of the bacteria. So they stop the bacteria from actually multiplying, and they then need the body to kill those bacteria through the normal defense mechanisms. The bactericidal antibiotics actually slows the metabolism down to such a degree that the bacteria die, or it actually ruptures the membrane, the cell membrane of the bacteria. So we very seldom use bacteriostatic and bactericidal antibiotics together. And then we must, of course, look at what pathogens we're going to be treating. So I think that simple question, can you mix antibiotics with others? The answer is yes, but always under guidance of your veterinarian, and specifically a veterinarian that has good knowledge of what the treatments are and what they should be doing. So that's that question then. Can you mix antibiotics with vitamins? And here I can give you a far better and easier answer. Yes, emphatically you can. Again, with some provisos, okay? It does depend on what antibiotic and what vitamin. And a good case in point is that normal tetracycline, the old terramycin or chlortetracycline, the older types of tetracyclines, you were never able to mix that or allow the bird to take calcium, because that would bind the tetracycline and it would then not be absorbed. So there are quite a few of these cases where you would not want to use an antibiotic with a mineral specifically. Another case in point is actually iodine and also iron and iodine. In some cases, the antibiotics don't do well when they're mixed with those. So generally speaking, if you mix using the vitamin the B co-vitamins, so B1, B2, B6, B12, all of those, they they can mix with any of the antibiotics, but be careful on your minerals, your trace elements, and also then be careful when you're dealing with iron and iodine. So that's the sort of broad spectrum answer. Can we use antibiotics and vitamins together? Next one, please. Then just leading on to that question, I want to explain what my motto has been since I started MedPet many years ago. And I think when we started AvioMed and actually grew in our knowledge and our ability to combine nature with science, we've really now reached a point where I believe, where AvioMed is the leading company in the world. And I say that with absolute honesty. And if you go and look at the other companies, very, very seldom do you find in those companies that they're actually combining what we call nutraceuticals. That's being the natural products in nature that will either stimulate the immune system or stop inflammation or have a multitude of other effects. Combining that with mainstream medicine such as antibiotics, such as antiparasites, the parasitic diseases and things like that. And that's been my focus in the last 15, 20 years, to combine science with nature and in such a way actually give us the best possible way of treating the bird and preventing disease. So I really would like you guys to have a look at the subscribing of science and nature. You can go to the next one. Thank you, Renata. So the next question is, what causes gradual decline in breeding performance over time? And I think that's, again, a very difficult question to answer in a short space of time. But I think the moment that starts happening, you need to consider overcrowding. There's no doubt that if your loft aviary is too full, that they compete for nesting material, that they have a stress syndrome where there is just too many birds for the space around them. Remember, these birds are free-flying birds. They can live when they're in the wild, they live in massive trees. And overcrowding is never a problem. The dominant males and the dominant ones of the species will be able to crowd out the others and get them to move on to other areas or to other trees, etc. In a loft and an aviary environment, that's not possible. And again, also for disease control, overcrowding is by far one of the major causes. So very carefully go and look at your aviary and be critical about it and say, have I not overcrowded this aviary? Shall I not rather build another one or get rid of some of these birds and actually have a far better health in my birds as well as breeding performance? There's no doubt that the adverse and changing weather patterns that we're having, the winters, summer's coming late and the winter's staying longer, those are major causes, because these birds are all dependent on daylight length and heat and sunshine. That's actually what kicks the whole metabolism into breeding mode. And if that whole metabolism wasn't kicked into breeding mode in the right time and at the right environmental conditions, you're going to have a bad season. Very, very importantly, and there we'll be able to help. There we can actually say that's where AvioMed's strength is. We can really offer you nutritional advantage over and above the food. And I very strongly would urge that you guys stay away from just seed itself. You need to find yourself a good soft food mixture, and to be able to supplement with protein, animal protein that these birds can take. And then make sure that your major nutrients, the protein, fat, starch, and fiber, is adequate. But there are many smaller nutritional elements, such as the vitamins, such as the trace elements, such as the minerals itself, which play a major role in the breeding performance. and we need to actually supplement those with very specific pigeon or bird specific supplements. For goodness sake, again, if I can ask, don't go and use horse supplements and cow and cattle supplements. There's a big difference between the supplementation that birds and pigeons and birds would need compared to these other species. And then very, very importantly, subclinical diseases, many subclinical diseases, such as the cochlosoma, the coccidia, worms, chlamydia, ornithosis, salmonella, mycoplasma. Those are just some of the many subclinical diseases that your birds can get. And the moment there's a subclinical disease in the loft, you're going to get poor breeding performance. Okay, next one. So what causes infertility was the other question. Again, it's very, very much the same as the previous question. You go, previous question, whether there's bad breeding performance. In other words, there's no libido and they're not actually breeding, they're not even going down to lay eggs, or whether it's actually infertility where the hen is actually laying the eggs, but it's not hatching. And again, overcrowding, adverse changing patterns, nutritional reasons, and subclinical diseases, all the same thing. But here specifically, the nutritional disease reasons and the subclinical diseases are two of the major factors that cause infertility in birds. I've developed very specifically this product called AvioFertical. It truly, if you go very carefully into it and you look at what it contains, there is nothing that competes with this product in the world. It's the only product that contains 3 different calcium salts, because we've learned over time, over the last many, many years, we've learned that pigeons and birds do not absorb calcium very well. So you need to use very specialized calcium salts to ensure good hatchability and good egg shell formation. This product contains all of the vitamins and minerals that the birds will need specifically in the correct formulation. And then very importantly, it contains coenzyme Q10 to stimulate maximum fertility in your little cocks, in the male finches, and astragalus powder to stimulate maximum fertility and libido in your females. So an absolutely unique product, not to be confused with any of the others. Again, we don't give it in the water, we give it exclusively over the food. It also has a gel formulation that you mix it with water, and it adheres again to the seed, or preferably then mixes very well into your soft food. So Fertical, really a product of great significance, and something that I would strongly urge you to also use. Something that I didn't put up here that I may just also mention then is that when you're dealing with fertility problems or in the breeding season, remember that your oils also play a major role. So you need to supplement your food with oils, because often the seeds that we get are deficient in oils. And you need omega-3 and omega-6 oils and along with that, your vitamin E to actually stimulate fertility in these birds. So a good oil product such as Avio Feather and Immune Oil is actually something that you can consider adding to your treatment, after your regime during the breeding season. Okay, Renelle. Then there's the ever so common question, what causes baldness and what is the treatment there for? So very basically, the nutritional deficiencies, when they start feeding babies, this often happens. Mite infestation, we said the burrowing mite, and then compressed malt that I'll talk about a little bit, and low-grade intestinal diseases. So the nutritional deficiencies and the feeding of the babies, we're not going to go into. On the next slide, we'll talk very briefly about a malting product that we've developed and the advantages of those. The mites we've spoken about, but I want to talk then very briefly just on the compressed malt. And the compressed malt is basically a scenario, again, where there is nutritional deficiencies that actually cause the malt to be delayed. And then when the season changes, so in other words, the malt doesn't start off in the right time. And when the malt then actually does start off, when the season has changed adequately, because there are deficiencies in many of the trace elements and minerals, and to some degree in the iodine, and we'll talk very briefly about the iodine just now, the malt then actually kicks in very, very quickly and kicks in too aggressively and too fast. And you get these little stubble feathers that starts growing out of the sides of the cheeks and on the head, and often also from the wings even. And that stubble delayed molt actually has a significant effect on the breeding performance. It's been proven conclusively that if you get compressed molt, that the following breeding season will not be a good breeding season. So coming back again, that's why it's so hugely important that we actually supplement them with the correct nutritional products, and that we actually make the reduce the overcrowding and all of the other issues then. Okay, so just bear in mind that the compressed molt can be a reason for bad breeding performance as well. And then we've spoken about low-grade intestinal disease, and again, specifically the cochlosoma and coccidia and worms are the three things that may actually cause this baldness and actually play a role in the compressed molt. So that's effectively, in a nutshell, what would cause the baldness and the treatment thereof. Okay, Runel? So, as we've said, the adequate molt is critical for the following season's breeding success. And we've spoken about vertical, that plays a role once they start breeding, but you need a full and effective molt to ensure a good breeding season. And again, AvioMalt, as much as vertical is a world breakthrough product, so much AvioMalt is. When I had MedPet and I started MedPet, we had the product called the Pre-Molt 100, which was basically a really good vitamin mineral supplement, but it had only vitamins, minerals, and one or two of the amino acid. AvioMalt has gone way beyond that. It contains omega-3 oils in a powdered form. It contains every single element that you need that is in pre-molt, and then it contains iodine in the correct amount to actually kickstart the thyroid to get your molt going and to maintain your molt. And it even contains a tranquilizer, a natural tranquilizer, so that when the birds go into the molt, they can slow down and they can actually reduce the stress of the molt itself, and they can actually rest and go through the molt effectively. So if tonight I can really advise two products that you guys can use effectively in your breeding season and molting season, it would be the AvioMalt and AvioVertical. Okay, Renelle, next one. We spoke about that. Now, just put the question here again. My birds are passing undigested seeds in the droppings, and what is the cause? And we said cochlosoma, coccidia, worms, and then bacterial diseases. So again, there's no single reason for it, but when you see the undigested seeds, think very heavily again on the cochlosoma and the coccidia. The worms and the Salmonella, E. coli, all of the others can also do it from time to time, but mostly it's these diseases that actually damage the intestinal wall to such a degree that the nutrients can't actually be absorbed, and that actually damages the intestine to such a degree that the food actually can't basically be digested adequately. Also remember that specifically the cochlosoma lives in the crop and what we call the proventriculus, the first part of the intestine or the stomachs, and that's where the digestion also takes place. So if the crop is not adequate and it actually doesn't push the food through carefully enough, some of these seeds will become rancid, some of them will become too swollen and can't then be digested. So that's basically the major causes is cochlosoma, coccidia, worms, and then the gut bacteria that causes these droppings, the undigested seeds in the droppings. Next one, Renelle. The adequate molt, we've spoken about that, so you can go to the next one. Thank you, Renelle. We've spoken about the premise. Okay, you can go on as well. We've spoken about all of those. There just gives you what it contains. Just go back again, Renelle. Yeah. So omega-3 6-9 via krill powder, a very specific omega-3 type of organism that lives in the sea, almost like a crayfish. Very small little organism, and the best form of omega-3 comes from krill. Even contains MSM and glucosamine for feathering, iodine in the absorbed state, AAC, tyrosine, which is the other hormone, natural hormone that stimulates the thyroid to get the molt going, and then all the B vitamins that you find in brewer's yeast as well. Okay, Renelle, that's just a summary of what is in there. There was a question, what's the difference between bumblefoot and gout? So left top, you've basically got bumblefoot. Bumblefoot is normally a thing that you will see that the bottom part of the foot actually becomes thin thinned down. And when the birds perch, the little pieces of sticks or the little pieces of even seeds and stuff sitting on the perch can then actually make minute scratches and cause little wounds in the skin, because the skin is thinned to such a degree that the superficial layer of the skin, which we call the epidermis, the covering layer, is no longer there. And the bacteria then enter through the skin and goes into the pads of the feet, as well as sometimes into the joint of the feet. So these are basically infections, and the reason for that is primarily, again, malnutrition in the sense of a deficiency of vitamin A, zinc, and biotin. Okay. We basically, the one at the bottom, left-hand bottom, is basically gout. That's something completely different. That is always in the joint. So you'll find it in the hot joint or within the toe joint. And normally you get these white crystals, white, pale yellow white crystals. And that is caused by kidney disease. So when the kidney is deficient and malfunctioning, it can no longer excrete enough of the uric acid. So it's exactly like gout in humans. Very often, as I mentioned before, the sulfonamide treatments will actually predispose to this, and you will get these crystals forming. And once the crystals are there, it's almost impossible to get it out of the joint. So very painful joints with a white pink sort of area sitting there and no treatment. Bumblefoot you would treat with, if it's a very valuable bird, you will treat with a vitamin A-E injection. You will treat it with a good antibiotic for an extended period of time, and sometimes we can resolve the infection. And then lastly, on the right-hand side, we've actually got pigeon or canary pox. So that is actually when the mosquitoes and midges bite the birds and there is pox virus around. They will introduce the pox virus into the superficial layer of the skin, and the pox virus will actually grow there, and that's basically pox. They're sitting on the outside of the skin, and those you need to then actually see whether you can get a vaccination, and very specifically then also try and prevent the mosquitoes and midges from entering your aviary. Okay, so next one, Brunel. And here we're going to stand or stay for a few moments. It's an important question. What is the cause of twirl or twirling? And I think everyone that breeds with Gouldians has seen this in the past. And again, I'd so love to say to you the cause of twirling is boom, is this, but that's the furthest from the truth. I actually found in my research when I started preparing this lecture an excellent article by a veterinarian which wrote a whole summary about this disease, and then took Gouldians that had twirling and had many different underlying disease problems as a cause of this twirling type of syndrome. So the take-home message with twirling is that it's a syndrome. Okay, you can never say this causes it. It's always multifactorial, so it's always a combination of different things. They very strongly believe that deficiency of vitamin E plays a role. So again, in all of the supplements that we have an adequate amount of vitamin E. So when you see twirling starting, think of vitamin E deficiency. It's something that you need to think about. Is there a genetic predisposition that some strains of the Gouldians and Gouldian Finches, etc., are more prone to getting this? Yes, it looks that way. It hasn't been proven. Okay. Toxoplasmosis, which is a fairly rare one cellular organism like coccidia, seems to and may be playing a role. Very, very difficult organism to treat. So again, if it's there, we hope that it's not that's causing it in your bird collection. Paramyxovirus and polyomaviruses has been isolated out of these birds with twirling. And I very strongly believe that the polyoma may very well be a fairly significant cause as an underlying problem for twirling. Paramyxo would cause more a loss of balance and basically not so much an immune deficiency where the other diseases can come in. So I think polyoma is the one that is most probably causing the most problems there. And currently there is no vaccine. Many years ago, I brought a polyoma vaccine in from America on special dispensation, but it's no longer available. And then the moment you've got all of these other predisposing diseases, the bacterial diseases such as Salmonella, E. coli, many of the other bacteria will go into the middle ear and actually cause a loss of balance. So this is essentially a middle ear inflammatory disease and infectious disease that causes this because of many different reasons. And then, of course, you can get some poisoning, such as enteral poisoning may look like this. Lead poisoning may look like this. So again, I can't give you a single answer, but when you've got this disease, if it becomes a major issue in your aviary, I strongly urge that you take a few birds, have them sacrificed, have good full postmortems done with histopathology at an avian practice or an avian veterinarian that can do this for you. But no single disease answer on this one, unfortunately. Right? Okay, so what would I recommend? So, if you do have a scenario of twirling in your aviary, I would go initially with a combination of these three products. The AvioRotaban. This is a combination immune stimulant, probiotic, in other words, the good bacteria, prebiotic, the fibers and sugars that the good bacteria live upon, garlic extract, beta glucan, which is an immune stimulant, and then two very specific plant extracts that stimulates the immunity and actually has been known to be virucidal and viral inhibitory. So if your polyhoma is playing the major role there, the Rotaban is the answer. You put them on a 7 to 10 day course. I would go 10 days of Rotaban every day. In the postmortems that this vet that I alluded to that did the postmortems and did the publication, he found many of the birds that were twirling actually had liver disease of many different reasons. So the Avio Liver Boost is a fairly new addition to our product range. It's the same type of products as Lever Stim from MedPet, which I developed many years ago, but again, highly improved with choline and many others, and even cranberry extract in there as well. So you then use Avio Liver Boost every second day. You put them on Rotaban every day, Avio Liver Boost every second day, both of those then for 10 days. Then you can go on with a Liver Boost once to twice a week, and you can basically use the Rotaban twice a week then as well. And then I would strongly suggest that you go for a 7-day treatment of the typhoid cure. Now, this is an absolute example of combination antibiotic developed by a veterinarian, by myself, that looked at all the different facets. So this is an amoxicillin, chloramphenicol, pheraltidone combination, and it's very, very highly effective against Salmonella and E. coli and many other bacteria. And the big advantage is that it actually, via the chloramphenicol, penetrates into the middle ear of the birds, where the bacteria often cause their problems, and also in the liver tissue where there is often a problem. So 10 days Rotaban, every second day Liver Boost, and 7 days typhoid cure in the water. And again, there the Liver Boost and the typhoid cure combines very well in the drinking water. So that's a try it and see whether it sorts your problem out. If that doesn't sort the problem out, then we need to go and get all of these postmortems and very specialized tests done. Okay, thank you, Renelle. Next one. Okay, I think, Renelle, we can basically, this is it for the formal lecture. So I don't know if it's possible for us to put the people onto speaker and that they can ask questions, or in what way we'd like to do the questions. But I certainly, if the people would like us to carry on with a bit more general questions, I can take some questions with pleasure.
No, thank you very much, Doctor. I think this has been an extremely informative session. There was a lot of, you're okay, now we know exactly what the problem is, situations or scenarios. So thank you very much, firstly, for the very informative presentation. Then we can open up to the floor. Any additional questions that you have been experiencing that you need some answers on? So we open it up to the floor.
Hi, it's Russell here, Dr. Ockert.
Yes, Russell.
Thanks very much for this fantastic talk. I've learned a hell of a lot, especially of the products that's out there in the market. But if you don't mind, I want to just be a devil's advocate for a moment. There are a lot of bird keepers and breeders that obviously have the means to get all these products and tender for their birds, etc. But on the other side of the scale, that those are that can't. What is your view around the home remedies that are out there or that are spoken about? For example, I've heard of one where you can mix apple cider with water for deworming.
Yes. Yeah, I think it's an excellent question, Russell, and I totally agree with you. You know, I know that it's not always possible to grab for the medicines, and I think that's why I said specifically my approach is a much more holistic approach. And I think you saw in the products that I highlighted, they're not so much the antibiotics as the immune stimulants and the stimulants, etc. You know, the health stimulants. In my research in doing this, I actually found two very good and adequate websites. Gouldian, if you just Google Gouldian, you'll find that there are two websites where somebody that's been breeding, and I can't remember exactly what they called the websites, 24 years in Gouldian breeding, they give a lot of sound and good advice. There were some things that I saw there that weren't correct and that was misrepresented, but nothing that of major concern. So yes, nature is there to help us, and absolutely apple cider vinegar is a fantastic product in the sense that it actually has a natural candida and inhibitory effect against the bad bacteria. It also drops the pH of the intestine and in such a way that stimulates the growth of the good bacteria. So I think in all of those, if you look at the natural things, I definitely don't want to discount it. It's very difficult sometimes to get hold of the natural stuff and to get them in adequate quantities where they are effective. But I certainly won't scoff at them. That's part of my approach. So I think answering the question, there are many of these things, but one just has to bear one thing in mind, and that is when you're dealing with a disease, like the cochlostoma, for instance, or like coccidia, the natural products will not be adequate to heal that disease, and you will sometimes need the medicines as well, you know. And I think the one take-home message that I also always give my racing pigeon fanciers is that, you know, I'd much rather that you have, instead of 200 Gouldians, that you have 50 Gouldians, and you have got extra funds to actually supply and get a hold of the well-researched and high quality products, you know. So in my mind, to summarize, I think there's a lot of good out there and a lot of good information on these Gouldian sites, and I certainly would never say that you shouldn't use them. You know, I don't know if that answers the question, Russell.
Yeah, thank you very much. That's awesome. Thank you.
So what we are, just as we're waiting for more questions, Ronaldo, you may wonder why these photographs. So this is just a very good colleague of mine, friend and colleague of mine, Dr. Philip Stapelberg, and he's actually does some tours. I don't know if he does it anymore for bird watching and bird photography, and he's just taken these most incredible photographs. Maybe you want to show us one or two more, Ronel, and I thought I'd just place one or two of them to show you how beautiful some of these birds actually can be. And I think you guys, knowing more about the beauty of birds, would really enjoy this, you know. So Philip Stapelberg, really an amazing guy, and one of the people I have huge respect for. So any more questions, you guys? I'm sure there must be more questions.
Dr. Botha, if you can hear me, my name is Keith.
Yes, Keith, I can. Thank you.
Thank you very much for the very informative talk. Could I ask you, would you advocate a preventative maintenance on a lot of these diseases, or would you treat only when symptoms occur?
Yeah. Okay. Again, a fantastic question, Keith, and that's why I'm so pleased that we've got a little bit of time to do these questions, because it's so difficult to focus on everything. So in answering your question, yes, I definitely think, and you'll find on the AvioMed website, and just while I'm talking about that, that's simply, you just type in AvioMed, and you should get to the website, but it's AvioMed, aviomed.co.za. Sorry, I didn't put it in the talk itself, but you'll find it there. And you'll find there that there are, oh, there it is. Sorry, thank you, Renel. You'll find that there are many different treatment programs there, especially for the pigeons and the racing pigeons. And the final answer here is yes, I do think that there are certain diseases, such as I've mentioned just very quickly in passing, the cochlostoma, coccidia, worms, where you do need to treat these every 2 twice a year, and from time to time, and especially before the breeding season starts. I stay away from any treatment whatsoever in the molting season. So once the molt has started, I try and stay away. You need to then only treat if there's a true emergency and you have to treat the birds. So in the molting season, I rather supplement them with the avio malt and the oils, etc. But in the pre-breeding season, in your scenario, pre-breeding season, I would definitely say that there are some diseases and some of the parasites that you need to treat. Again, we must be careful in the sense that you don't have to treat everything, and some of them you can wait for the disease to actually show itself. A very good example is a thing called red gut. That's Clostridium. It's a very specific bacterial infection of the intestines that causes bloody diarrhea and acute deaths in the birds. And there's no sense in treating it because all birds carry it in a low grade, and you can't actually ever get rid of it. So you don't treat for that preventatively. If your birds don't have a high salmonella problem, a paratyphoid problem, I wouldn't treat for that. But I would standardly, and I promise you I will go back to the canary program, and because you guys have shown so much interest now, I will go and highlight which diseases I believe you need to treat before the treatments, before the breeding season, and in sometimes during the breeding season. But the mainstay should be prevention via your nutraceuticals and your vitamin minerals and type of things.
Thank you very much.
Can you hear me?
Dr. Ockert, this is Eric. Just want to ask a question regarding to bumblefoot.
Yes,
What
sir.
treatment is there? I heard you talk about a treatment, but my phone wasn't so
Okay. Yes.
clear
So,
enough to hear that.
right. So the bumblefoot, the biggest thing is to make sure that it doesn't happen. And by doing that, the best possible way of actually doing that is to use the avio malt regularly, because that will supply your vitamin A, your vitamin E, your zinc, and your biotin, amongst others. So the avio malt is something that even if they're not in the malting stage, it actually has a beneficial effect. And I think in your Gouldians, where color and where feather quality is of such utmost importance, if you are going to show them, the avio malt can actually be used right through the year. The multi-breed and multi-vite also contains that. So a good balanced vitamin product with a emphasis on vitamin A, E, zinc, and biotin. Those are the main issues to prevent it. If the bird has already got the disease and there's an infection in the joint, in the pad, and so on, sometimes if it's a valuable bird, you must actually scrape that out or get a vet to scrape that caseous material out. You can actually put a good antibiotic ointment into that, but you need an antibiotic as well. And in this case, I would, if it's many birds are suffering or you're treating a flock, I would use a product called Avio Muscle and Wing Mix. That's a high dose amoxicillin and neomycin, and the amoxicillins is the best treatment, or the Linca specta. Avio Linca specta would be excellent as well. The lincomycin is a really good antibiotic for the bacteria that live in that bumblefoot. So if you'd like to write down Linca specta and then muscle and avio muscle and wing disease, and then vitamin A, E, zinc, and biotin.
Okay, thank you very much, Doctor. Because luckily just one bird, a valuable bird.
Okay,
and
no,
then
then
question, yes,
yeah.
And question number 2, that vertical.
Yes. Sir.
How many components are in that one of yours? I just want to just get the clarity. And is it in a liquid form or is it in a powder form?
No, it's in a powder form, and I can't tell you offhand. And unfortunately, if I go out of here, I'll be lost. I'll cut us off. I'm a bit pre-computer.
Okay.
But if you look on the website, it actually notes what is in there. I think it's about 15 different products, and it's basically in a food application. Okay.
Okay, doctor.
As
Thank
I
you
say,
very much,
it's actually got 3 different calcium salts, and that's what also makes it
Yes.
very, very unique.
Yeah, okay.
Doctor,
Thank you very much
can you hear me?
for assisting us. Thank you.
Hello, Doctor, can you hear me?
Yes, I can hear you, sir.
This is Russ. if you have a sick bird, it's obviously sick, but you don't
Yes.
know why.
Yes.
What would your suggested treatments be on that? You don't know what is causing it.
Yes, I think again, I think it's a really good question, and it's a question that I can answer with some clarity. Okay, so obviously it's always better to have veterinary advice, but I do realize that that's often not possible. I think the main thing you need to ascertain is this bird sick with a respiratory disease, or is it sick with a gastrointestinal disease? And in those cases, it would then be a systemic disease. Okay, so gastrointestinal, so is it a stomach? And is the main symptom that of diarrhea and something vomiting, things going wrong in the intestine, or is the main symptom that of the respiratory tract? Okay. If it's respiratory, I think there's absolutely nothing better than the Aviospirodox as a general treatment. Okay. And again, I see that somebody is kind enough to actually bring up the images. So the respiratory ones, I would use Spirodox because it contains doxycycline at the right dosage, a very high quality doxycycline, and it contains spiromycin. And spiromycin works for mycoplasma, and doxycycline works for most of the other bacterial diseases as well as for the chlamydia. So respiratory, I would use Spirodox in your loft scenario. And when you're dealing with an intestinal disease, when it's basically a whole problem with the intestine, so there's the Spirodox that's available in tablets and powder form. So you can crush it and basically give it directly, or it's available in a powder form for loft treatment. And then if it's an intestinal disease and they're dying, the birds are dying, I would then go with a typhoid cure. The typhoid cure is truly, truly a unique, broad spectrum general antibiotic. Now, the typhoid cure and all of the products that have the white labels on, and you'll see that the bottom of the AvioMed label, there's an RX on there. These are prescription products that is available only on prescription from myself or a veterinarian. They can script for it as well, but it's available. So that's not going to be available on your pet shop shelves or stores or co-ops. It's only available on prescription, and it's very simple. There's just a form that you fill in, and you actually give me the symptoms of what's wrong with the birds, and we basically then will be able to supply you directly with the prescription drugs. Okay, so you've got to be a client of mine, and I've got to have some record of what's wrong with that bird or what the symptoms are, and we will then, and we don't charge a consultation fee. There's no consultation fee whatsoever. We are at the point of launching the website and the app, Pigeon Vet, where you can do the same and where you can electronically register as a client of mine, and where you will then be able to get these prescription products available.
Notice you never mentioned heat to a hospital cage or anything like that.
Yeah, so are you referring to Candida then? No. The yeast?
Just a sick bird. Just a sick bird.
Okay. So just let me get the question again. A single sick bird.
Yeah, a single sick bird. You don't know what is wrong with it.
Yeah.
But you never mentioned heat as being.
Okay. Again, I would say that if it's a single sick bird and it's a respiratory disease, that you would use the Spirodox. You would put it into the little isolation cage by itself. If it's still drinking, it'll get enough Spirodox, and if it's still drinking, it will get enough typhoid cure. So that antibiotic I would use then in single sick birds as well. Obviously, if you have the means and you have a veterinarian that will be able to, or would be prepared to, which very few are prepared to do, supply you with some injectables, something like the Baytril injection or the Citavet injection or the doxycycline injections is first prize, but very seldom, and especially with the Gouldians being so small, you really need to know how to inject the Gouldian, not to kill it with the injection.
Thank you, Doctor.
Any more questions?
Yes, Dr. Botha, it's Keith again.
Yes,
Where
Keith.
are your products available? From where can we purchase them?
Keith, they're available on most of the larger bird pet stores, such as Turf Pets, Diamantstutterij. In the Swartberg, they're basically now available on the agri co-ops as well. And then, as I say, you can order directly from us as well via this Pigeon Vet website, or just to phone. And I don't know if there's any way you can get, well, if you go onto the AvioMed website, the contact details will be there. So we do direct sales via courier as well. But many of the smaller pet stores are also carrying the products now.
Thank you.
Any more, guys? I don't know, Runel, can you see anything on the chat? Was there a question asked on the chat, on the type chat?
No, nothing added.
there.
I just see that Siebert has added the contact details if they want to order.
Okay, there we go. Thanks,
Yeah,
Siebert.
I think one of the questions from our side is, I've noticed with the AvioMed products, it's obviously very much aimed for the pigeon industry and fully respected. So the quantity that we would use, for instance, for the Gouldians is very, very minimal compared to, you know, it's not like 2 kgs of food that we would prepare. So do we then just do the dosage ratios accordingly?
Yes, you'd basically have to just weigh down. And I think the best way is always to, if you're doing the food application, it tells you exactly, it's normally 5 grams to a kilogram. So, you know, if you can then get a 1 gram scoop, which you can get hold of, it will be basically, you know, 5 divided by 1. So it's 1 gram per 200 grams of food. So you can definitely just work back on the dosage regime that's on the label itself then, you know. We will be looking also, we're looking at poultry, show poultry specific products, and then also on aviculture specific products. But again, on the aviculture specific products, you know, then now you have an aviary of 200 or 300 birds. So maybe I should rather ask the question from you, Runel, and from the people that are actually here. What is the normal amount of these Gouldians that the guys would keep? Generally speaking, how many do you normally have in the flock itself?
Well, I think it ranges quite significantly. There is guys that obviously have hundreds of them. Mackie, I'm not sure how many you've got in your setup at the moment. Eric? Nope, I think we've lost him.
Yes. Sorry. But that's a finger troubleshoot. In my aviary, where I keep all my young birds that I was breeding, I'm sitting at the moment now with 60 of them, which there is also 12 pairs in, and I usually dose them, say the AV mold that I started already, 5 grams on a liter of water every second day. That is second or third day.
Okay.
Yes, but it's also still the product of MedPet that I was still using. So that is why. Okay.
Yes, and I mean, I just want to reiterate again that, you know, the MedPet products are absolutely exceptionally good products still. And it's very, very well known, because I started the company in 1988. And we were focusing primarily on when we started AvioMed, on the pigeons and the racing pigeons, and with the help of Siebert now, we've basically gotten so many new requests for aviary birds. So we will be looking at changing some of the not formulations, but the packaging options, you know, into possibly smaller pouches or something like that, to help the aviary people as well. But I think the biggest differentiating factor in AvioMed and MedPet currently is that we are constantly innovating with new products. Research is ongoing, and you know, I do believe that in many cases we have products that are more modern and more critically developed in the sense of than the old technology when I developed the products in '88 and up to the 2000s. You know, so.
It
I
just
think
adds
what I
more
mentioned-
value to us because, yeah, there's the price of the products and compared to the dosages, it's just going to last us quite a long time. So
Yes,
the
yeah.
value add is definitely there.
Thank you, Ronel. Yeah, I think I also want to just say that again, Sibert, I think you are still there, so he's certainly helped tremendously. We've the AvioMed pigeon breeders or pigeon fanciers group has got about 900 members at the moment and is very, very active. And I constantly answer questions on there. It's unfortunately impossible for me. I do go and look at the other groups, you know, the pigeon breed, the fancy pigeon breed, the poultry breed, and your groups. But I can't answer questions on all of them. It becomes impossible. Often you'll see my answers come through at 2:30, 3 o'clock in the morning. But if you place a question on that group, on the AvioMed group, and I don't know, Sibert, how we can actually get, maybe we'll just, Ronel, if you can just send that link to everybody that attended tonight. That's actually the forum where, even if it is a Gouldian or a bird, you can ask the question upon that, on that group, and I'll do my utmost to answer the question there then.
Perfect. That's much appreciated. Is there any other additional questions or comments from the members, perhaps? All right. If there's no other comments or questions, we would just like to thank you again, Doctor, for taking the time out and sharing such valuable information with us. I think this is we've started this relationship in February already, where you sponsored some prizes to our show as well. This is the Supreme Show. So we truly appreciate all the time and effort that you've put in. And yes, that WhatsApp group definitely helps quite a significant, as I've had one of my Gouldians stuck in the mold as well. And within a week or two, with your advice, it definitely made a huge difference. You never think it's the same bird that I currently have. So no, thank you very much again for your time, and thank you everyone for joining us. We do appreciate it. And we
Last question, please.
Yes.
One more, yes, certainly.
Sorry, the network. Last question. MedPets AminoVet H.
Yes.
What is your equivalent one that you are having at the moment, Doc?
The
You see,
multi-
Doc,
yes.
why I'm just asking, because I bought a lot of MedPets. So I must first get rid of it or finish it up, not get rid of
Of
it.
course.
Finish it up because it's expensive stuff. Then I can start going up to your
No, of
to
course,
the new
I understand that.
products. So I'm just
Yes.
checking now. Yes. Which other one do you?
So the multivite is the equivalent there. Again, you'll also see, like in the AminoVit H, the multivite is also a food application, not a water application. And the reason for the AminoVit 8 that was a food application is, again, the minerals and the trace elements that don't mix with the water well. So the multivite and multi-breed, but specifically the multivite is a really good comparative one.
Okay. Thank you, Doc. That was my last one. Sorry, Ronel.
Then Ronel, Sana just asked my wife that was that's the owner of AvioMed. She just said, please remember to say thank you very much for your support, and especially your renewed support, not renewed support, but the fact that you are embracing us so wonderfully. And we will definitely keep on sponsoring. We'll definitely keep our relationship with the Gouldian Breeding Society alive. So it's been an absolute honor and a pleasure to speak to you guys tonight.